have a risk to occupational exposure. And then what is an occupational exposure? Any reasonable anticipated skin, eye, mucous membrane contact with blood or other potentially infectious materials. Example, percutaneous. Percutaneous is through the skin. So in other words, a needle stick, right? Or any type of cut or a human bite of any kind. And then we've got permucosal, and that is contact with mucous membranes through the eyes or the mouth. That would be an occupational type of exposure. Okay, so this next little category box, okay, my slide is actually towards the end of the PowerPoint, but let's go over that first. So who would be routinely exposed to blood, saliva, or both? Who do you think? Anybody?
Employees.
Which employees? Be more specific.
The ones that are working on the patients.
Correct. And that would be the
Operator.
Healthcare workers.
okay, so who works on patients? It would be the doctor, right? So the DDS. Who else works with the patients?
Assistants. Hygienists.
Assistants. Okay, so that would be an RDA or a DA. Who else will be working with a patient?
An RDA.
Who does the dental? RDH, correct. Also, there's one more. Specialized assistant would be a RDAEF, expanded functions. Okay, so those are 5 examples of a category of an employee who is exposed to blood, saliva, or both. Okay. So category number 2, may on occasion be exposed to blood, saliva, or both. Who do you think that may be? So again, you've got the front office, right? Front office people, then you have the back office people. So do you think the front office and the back office work as a team and they help each other out? Possibly. That's in a great office. Yes, they would. So if they help each other out, who do you think would be under this category? What type of an employee? Any guesses? Who works in the front office? Do you remember their titles?
RDA.
Well, she can, but that's not her primary job.